Hello, welcome to the Public Health Career Guidance webinar, where I will be providing an overview of the landscape of public health career opportunities, considerations, and what to expect as you're out there doing your job hunt, whether you are starting in public health or you are seasoned in the field and are looking to make a career transition. This information will help you stay grounded and keep your eyes open on all of the possibilities out there. So again, we'll be covering the scope and depth of the career landscape, some degree considerations if you want to go back to school for public health, how to navigate job qualifications or know whether or not you qualify, salary expectations, and then services and success stories of folks that I've helped get hired in public health. The mission of Public Health Hired is to demystify the employment process in public health and increase workforce readiness. As you know, our world has changed due to COVID, and our field is growing exponentially because public health professionals are in demand, yet it is still unclear for a lot of us how to navigate these job applications, how to really understand companies, and what your actual possibilities are out there for your career. So my goal is to help you navigate all of that. My name is ZOILA Reyna. I am the founder and CEO of Public Health Hired. I have over 15 years of experience in public health program administration, strategic planning, community engagement, policy analysis. I've worked at nonprofits, government, private research, and currently at a healthcare organization. I work full-time. I have helped 21 individuals get hired in 2021, specifically in public health all over the nation with various degrees specific in public health, whether they had their bachelor's, master's, or doctorate. And if you would like to learn more about how to work with me so that you can get hired, that will be at the end of this webinar. But as far as my experience in how I know what the hiring landscape looks like, it's from my own lived experience from navigating this field and helping others, but also because I've drafted actual job positions. I've been a part of hiring panels. I've helped increase the workforce at my own organizations, developed roles and scopes of work. And I've also been a part of an admissions committee at UC Davis, where I got my master's in public health as well. I want to start off by sharing with you the socio-ecological model that basically talks about the framework for prevention. This is something you will be familiar with if you haven't already seen this, but it acknowledges that our health as individuals is impacted by the folks around us, the relationships we have, our peers, our family, our friends, our coworkers, as well as the community we live in. As well as the society that we participate in. So the socio-ecological model simply acknowledges that we are impacted by our built environment, by our behaviors, and we're greatly influenced, whether subconsciously or consciously, about our environment. I wanted to also share with you what you will be running into often in public health is the social determinants of health. This basically is cited greatly in the world of public health. This visual was provided by the Robert Wood Johnson Foundation, and it highlights how our health behaviors, clinical care, social and economic factors, and our physical environment impact our quality of life and our length of life. So I circled the ones that are most prevalent in making an impact in someone's quality of life or length of life, which is health behaviors and the social and economic factors. So if you want to make an impact in people's lives and you really want to have meaningful work, I would encourage you to focus on those areas where you really help someone with their behavior changes, as well as the social and economic opportunities available to them, such as education, employment, and so on. I developed this next slide, which really highlights the potential focus areas that you might find yourself in if you want to work at a specific level within public health. What this means is some of us have an interest on working at the global scale, the national scale, or federal level, state level, county, region, or local level. And from my experience and looking at hundreds and thousands of job announcements, as well as navigating this field myself, knowing my colleagues, what I've put on the right is to show you popular scopes of work or focus areas that are within these specific spaces. So if you want to work in global health, you will run into a lot of support around communicable disease, disabilities, the infrastructure such as water and education. And then, for example, at the local level, looking at the other side of the spectrum, you might run into working more around public administration, healthcare, or even social health, such as food, housing, and even substance use prevention. So these are simply some considerations. This is not a perfect model, but these are very common that you will run into if you want to work within these certain spaces. And if you want to work at say the CDC, which is a national organization, they're very well known for focusing on communicable diseases and health inequities and so on and so forth. So this is just something to take into consideration as you're out there looking for type of work. As far as what the growth of our field looks like, I have some really great news. The U.S. Bureau of Labor Statistics has been cited as saying that our field, our opportunities are going to grow 2 to 3 times faster than other industries. So due to the pandemic, unfortunately, with COVID, we are seeing a great increase on demand for public health professionals such as yourself. And what I've done is highlight the titles or the types of jobs that are growing due to COVID. This list of job opportunities comes from what I see on job announcements on job boards, and they're pretty popular right now. Contact tracer, contact investigator, and then the other ones such as data analysts, program management, compliance officers, those have always been around, but they're growing more and more because there's a lot of interdisciplinary work where companies are having to work with government, with public health organizations, nonprofits work now closely with federally qualified health centers and clinics and healthcare. So there's a lot of cross collaboration, and public health professionals are in the middle of that kind of guidance and support. So keep your eyes out for these if you're interested in entering the workforce. This next slide I developed is something that I've been getting a lot of questions about, such as what can I expect if I've applied to a certain title. So this is not a perfect slide. I have an asterisk at the bottom that says pay grades vary. This is just some averages that I've developed based on what I see on the job boards, plus personal experience, plus helping people get hired. This is kind of the pay range that they're in. So based on a title, you could expect, such as a health educator or peer navigator, health navigator, to make $35,000 or $39,000, for example, versus someone who wants to be a program manager, analyst, or specialist could expect to make $67,000 or a little over than that. I want to point out that if you have your bachelor's, you should expect to get paid $35,000 to $65,000. That tends to be the cap. At $65,000 is where is the most that I've heard someone with their bachelor's make, and that does take time to get there. But if you want to make 6 figures, or if you want to make 80,000 or more, you should really think about getting your master's in public health, because that actually unlocks your salary potential, and you can expect anywhere from $75,000 to $130,000 for job offers. So something to keep in mind as you're out there working. These are some degrees and certificates that are popular in our field. Yes, you can have your bachelor's in public health, but the good news is that you do not need a bachelor's in public health to get started in this field. In fact, I have my bachelor's in psychology from UCLA, and I started off working at a nonprofit for program management, supporting with recruitment and youth development, worked my way up into more mental health work, doing some private research for substance use, and then found myself getting my master's in public health. So something to consider if you're out there, but if you have your bachelor's in public health, that's great. That's a great start. I highlighted master's on here because it does give you the best rate of return in your investment. So just keep your costs down. Please be mindful of how long you're going to school. You do not need to go to school for very long to get your master's. In fact, my program at UC Davis has a 1-year accelerated program. And there's also a lot of online programs out there where they get you in and get you out so you can start to make that money. So be mindful of that. And I encourage you to keep working, even part-time if you have to, in order to keep your costs down while you're going to school. That really will make an impact. But to give you a sense of what to expect, I was able to jump from $45,000 with my bachelor's to $80,000 with my master's degree right away. So you should be able to expect those rate of returns as well. You can get your doctorate, obviously, in public health, or if you're interested in public health nursing, that's also an opportunity for you. As far as certificates, the Certified Health Education Specialist, known as CHES, it's a certificate that's good for 5 years. And this is more common if you want to do that one-on-one direct outreach, do community health education, community promotion, community health promotion, but it is not required. So I just want to point that out. I myself was a part of a lot of outreach and engagement, but I found myself being a trainer for community health workers or those who have their CHES. So it's not required if you want to work in health education, but it is popular, and some companies do ask for it, while others simply want someone who is familiar working with, say, healthcare professionals, or is comfortable doing presentations and being a trainer. So that's something to keep in mind. You don't need it, but it is an option for you. As far as schools for public health, there's a lot of online ones opening up. I want to point out that they're very flexible nowadays. A lot of schools want to attract working professionals, so it's fine if you work while you go to school. They support you in that. And then also to be mindful of the number of credits that you're getting, that you're attaining. You only need 60 units with your master's in public health. So that's a very small amount of units in comparison to our undergraduate degrees. So be mindful of that. I always am wary of programs that want to keep you longer than 2 years. So you should only be looking at schools that offer a 1 to 2 year program, and that's it. You don't need to go to school longer than that. I have here a link of the accredited schools. I would encourage you to look into those and apply to those, simply because when you graduate, you will see that there's more ease in getting callbacks. And when a company recognizes the school on your resume, that speaks volumes about you. So stick to the accredited schools as much as you can, but I know there's non-accredited out there as well. Okay, quickly jumping into how do you know if you qualify for jobs? So you want to be able to, when you look at a job announcement, it's best that you jump to the bottom of that job announcement as soon as possible to better understand the preferred, required, or desirable qualifications. This tells you a lot about what the hiring manager really wants to see from you. And you want to make sure that you meet their minimum qualifications and a combination of your education and or work experience. And I want you to read that part carefully at the bottom where they call out the years required or the specialty they want or what's desirable, because oftentimes you assume that they want X amount of years in public health, but when you read the details, it actually calls out X amount of years in project management, program management, community outreach, data analysis, et cetera, et cetera. So there's very specific key terms that these companies call out where they want to know whether or not you have that set amount of years of experience. And oftentimes you do, but you undersell yourself. So make sure that you read that in close detail. And then if you want to know about what to expect for your pay, or what to expect for the reporting structure, read the reporting line, which is usually at the top of a job, that summarizes who you will be reporting to, whether it's a vice president, a director, executive director, so on and so forth. And that can give you some insight into what to expect for pay as well. So tips to get the job. These are some of the top tips that I have. So make sure you know what you're looking for. This field is broad, wide, and very deep. So you can really lose yourself if you aren't sure what you're interested, what your interests are, what you don't want to do, what kind of environment you want to work in. So let me highlight that the 6 industries that hire public health professionals are nonprofits, government, philanthropy foundations, healthcare hospital, private research, and universities. So keep in mind that these industries really vary as far as culture, environment. So be mindful of what you're really looking for and stay open to the possibilities for yourself so you don't box yourself in. In regards to resumes, the hardest thing you will learn to do is tailor every single resume. I am here to break it to you that you do need to tailor every job application because you must address that exact job announcement. And oftentimes you're not doing it. You're probably just using the same resume and hoping that the HR individual or the person who's screening your application will get you, but that does not happen. They want you to instead mirror their language, use their terminology, use their vernacular, and really come to the table prepared with the clear understanding of that job. So that's why you need to mirror the language. If you want to learn more, you can either download my masterclass, which shows you exactly how to do this for yourself with winning examples of resumes, winning examples of cover letters, and interview prep that actually got people hired. So I only share what works in any of my tools. I focus on what gets people hired, and that's either you can access that in the masterclass or even do a mentor session with me, which is available on my website as well. As far as what to do during interviews, there's a lot to consider for interview prep. My technique that I show you to do is called total recall, because I show you how to bring your experience in totality against the job by recalling and reminiscing in detail what you've done in the past. And it's a science-based approach where you really bring your experience to your prefrontal cortex and you feel like you just lived your past experiences yesterday. So it's revolutionary. It's what's helped me get hired time and time again, and what gets my clients to get that job offer. But if I have one piece of advice to give you for interviewing, is to be ready and prepare 1 to 2 questions back at the company. What this means is you need to have a very thoughtful, very clear question about the role or about the company that shows you've put a lot of thought into what to expect, or there's some holes of information that you want them to fill. So be mindful of this, because when they ask you at the end of the interview, so do you have any questions for us? You need to have something to say, and you cannot ask, what's the pay? That is the worst thing you can ask. You need to instead come up with a clarifying question about the role, Later, you can ask about salary, but do not ask about salary as your one and only question. And then the best advice I have for you is to not stop applying until you get an offer in writing. I want to warn you that it takes about 4 to 8 months to get hired in this field. I'm speaking from experience. I'm speaking from what I see with my clients and from my colleagues. This is a marathon experience. So unfortunately, our schools in public health are not preparing the workforce with the proper resumes, the proper cover letters, and even the proper interview prep. And a lot of us are being misguided or just expected to figure it out. And what I've done instead with Public Health Hired, all our tools and services, is to actually be real with you, show you what to expect, and prepare you to really apply like a professional. And my best advice for you, if you're just getting started, is to not stop applying until you get an offer in writing, because oftentimes you'll get very warm leads or warm callbacks. Maybe you do one interview, but within that time, you actually stop applying and then you don't get that job offer. So you've been wasting a lot of time by just hoping that a company comes through. So please be mindful of that. I encourage you to float through while you're looking for full-time work. You can choose to work part-time, temporary, contract, even volunteer. There's a lot of remote work out there. Continue to do whatever it takes, even part-time, so that you have some income and that you're not desperate as you're out there interviewing, because desperation does come through. And so be careful and just float as best you can. As far as searching and how to keep more possibilities coming towards you, I want to encourage you to download the Key of Common Terms that I've developed. It's 4 pages of information completely free on publichealthhire.com, where you can really learn about the best way to search for jobs specific to your interest. So I do not want you to search titles. If you've been searching titles, please stop doing that. It's actually keeping you locked out of other possibilities that are more fruitful. In fact, key terms, if you search key terms such as community engagement, implementation, strategic planning, all of these really rich key terms will actually pull up a variety of job options and a variety of salaries so that you can see more possibilities for yourself. And if you want to do a tailored job search, I do that as well during mentor sessions where I share my screen and I do a job search specific to you. So that's available as well. And then lastly, I want you to prepare for negotiation and be mindful of your salary expectation. So as you're out there looking at these jobs, some of them post salaries, and be sure to take note of what those salaries are. Maybe you don't want to apply to the job, that's fine. But if you notice there's like program specialists being quoted 65,000 or within that range, you want to make sure that you are tracking on what you're noticing so that when you are interviewing and you come to the table, you have a sense of what these titles are paying or what these degrees are paying you. So study the job boards and take advantage of the ones that post salary so that you can learn from them. And then I'm here if you need additional support and advice. These are some results from 2021. These are companies that my clients are now working at. So ranging from the California Department of Public Health, Florida Department of Public Health, UCLA, American Heart Association, Guidehouse, Ascension Health, Blue Shield, Drexel University, and among others here on the screen. So I can help you get hired either in a job or in an internship. The approach is the same. To land an internship is just a precursor to what it's like to land a job. Obviously, getting the full-time job is a lot more difficult, but you want to approach internships also the same, whether they're paid or unpaid. You want to start practicing those good habits of tailoring your resume, tailoring your cover letter, and preparing for interviews correctly. As far as what's available to you, if you want to work with me, there's the mentor sessions. They're 40 minutes over Zoom. We can talk about your resume, update your resume if you need. We can talk about interview prep. If you need actual interview prep, I do that with you. It's recorded. And I teach you my technique called Total Recall. I can also just give you some tailored career guidance if you aren't sure where to start, or if you've been looking and you're not making any traction, I can kind of give you some feedback. Or if you want to do an actual job search, I am available for that as well. I can share my screen and we can look at jobs together, and you'll get leads over that session. You can also download my masterclass. It's online self-paced course where you have 3 modules, and they walk you from how to find a job to how to apply with your resume and cover letter nicely tailored to how to prepare for interviews. And it includes attachments that are all winning, all winning attachments. What this means is basically these are cover letter examples and resume examples of folks who actually got hired. And you can download the template of a resume if you want to update your resume. That's also available on my masterclass. So go ahead and look at that in my website, www.publichealthhired.com. And if you want the ultimate package, it is my hired mentorship, where I help you get hired. Yes, this is available to you, where I will be working with you very closely on how to find the jobs. We do job searches together. We work on your resume and cover letter together. This is a learning experience because I want you to be able to do this for yourself in the future as well. So I don't expect you to work with me forever. I actually just want you to learn the best practices and evidence-based information that I've garnered on what it actually takes to get hired in this field. And this includes unlimited Zoom talk and text. You have direct access to me. We do weekly meetings. We see what progress you're making, and we keep the ball rolling until you get a job offer. So this has no expiration. It's all based on when you get hired. So if you want to learn more, you can follow me on Instagram. I drop job alerts at Public Health Hired. They are on my stories. The job alerts basically are jobs that I have screened and vetted specifically for public health, and they're across the nation, and I drop them at random. So please follow and check me out there. Or you can follow me on TikTok, where I drop lessons, lesson plan on considerations and things to be aware of when you're out there looking for jobs. You can also email me directly if you have some questions or want to book some time with me. You can also reach me on my cell phone here on this slide, or you can connect with me on LinkedIn. Otherwise, keep calm and job hunt on. You are super talented. Don't undersell yourself. I'm here if you have questions, and I believe in you. Have a wonderful day. Bye.